very, very encouraging early results. And I say it, what do you have to lose? I'll say it again, what do you have to lose? Take it. If things don't go as planned, it's not going to kill anybody. I've seen things that I sort of like, so what do I know? I'm not a doctor.
We have had some great response in terms of doctors writing letters and people calling on the hydroxychloroquine.
President Trump, as you can see there, has long praised the potential benefits of the anti-malaria drug hydroxychloroquine as a potential game changer in treating the coronavirus. Earlier this week, he even announced that he's taking the drugs as a preventative measure. But a new study indicates that the treatment could potentially be lethal. The medical journal The Lancet examined 96,000 coronavirus patients who were hospitalized across 6 continents. And it found that those treated with hydroxychloroquine had a significantly higher risk of death compared to those who were not. Those patients were also more likely to develop a type of irregular heartbeat that can lead to death. Now, this empirical evidence is in direct conflict with what the president has said about the drug. According to this new research, taking hydroxychloroquine can, in fact, kill you. And it gets worse. Trump had specifically been recommending that the drug be taken in combination with an antibiotic, a combination the new Lancet study says is yet more dangerous than simply taking hydroxychloroquine itself. Now, these findings come on the heels of a New York Times report from disease modelers at Columbia University. Quote, if the United States had begun imposing social distancing measures 1 week earlier than it did in March, about 36,000 fewer people would have died in the coronavirus outbreak. 36,000 people. Trump called the study a, quote, political hit job, while the country's top infectious disease expert, Dr. Anthony Fauci, agreed with most of the research, but with this caveat.
The logical thing to say, if you had done it earlier, you likely would have prevented a number of infections. I mean, that's just the way it is. There's no getting away from that. However, I have a little skepticism about models.
Joining me now, Dr. Erwin Redlener. He's an MSNBC public health analyst and the director of the National Center for Disaster Preparedness at Columbia University. And David Shulkin. He's the previous Veterans Affairs Secretary under President Trump, former president and CEO of the Beth Israel Medical Center, and the author of the book, It Shouldn't Be This Hard to Serve Your Country. Good morning to both of you. Dr. Redlener, let me start with you. Fauci says, and he's always said this, by the way, he's consistent about saying maybe regular folks who don't know these things don't understand modeling, but he says it's an obvious thing to say that if we started a week earlier, we'd have had fewer deaths. The distinction here is that a week earlier than we started stay-at-home orders, public health officials, including you, because you and I talked about this months ago, were actually saying we needed to do this. So it's not that it's if we had started something a week earlier that we didn't really know about, we could have saved lives. We did know about this.
Yes, Ali. And, you know, the interesting thing here, among other things, is that it was obvious, I think, that we should have started this particular procedure of staying at home earlier. And the problem is there was a lot of dithering, number one, among the states, and that was because we didn't have much in the way of a good central guidance from the federal government. They were all over the map, and it took a long time for us to get the picture that we needed to really close to save lives. And the other thing, too, Ali, is that it's not like we had a bunch of tools in our toolbox to deal with this virus. We had no vaccine. We still don't. We still don't have any kind of medication that seems to be working. So the only thing we could do and can do even now is close down to stop the spread. That's just become an obvious fact that's been accepted by literally the entire public health community. It's refuted by the White House. It was, I think, understood by Tony Fauci, but he never really got anywhere in trying to make the president understand how important it was to have a clear central message, Ali.
And David, this is something you understand. He never really got anywhere with trying to make the president understand the central message because you worked in this administration. There was a pandemic plan. It was brought forward by the last administration. In fact, one of the things that took place in the transition was a sit down between the old administration and the new administration warning about pandemic. There were plans at the CDC for, they came a little later for dealing with this, but they were held back by the White House. The desire to not have this pandemic be a thing has overwhelmed all impulse at the White House to do the right thing about it.
Yeah, Ali, I think that it's really important that we hear a consistent message from our national leaders that all that we want to do is to be able to follow good, sound advice that's backed up by evidence and science. And I think, as Dr. Redlener said, we know what is effective in preventing the spread of this virus. It is not only social distancing, but it's good hygiene, the use of masks, and treating this virus cautiously. We also know that it's important to give a consistent message about what works and doesn't work. And the concern that I have is with the messaging about hydroxychloroquine is that as physicians, we're taught do no harm. And we know that this drug, if it's not used properly, if it's not monitored, can cause harm. And that's why I believe strongly that this drug should only be used in the context of a clinical trial. There is a clinical trial still going on to take a look at whether hydroxychloroquine has any effect on the prevention of hydroxychloroquine. But the issue about treating and being effective in patients who have COVID-19, I think that we can put that issue to rest. We've now seen 4 studies, the first one coming out of the VA, and now this last one in Lancet, all showing the same thing, that this is not an effective drug in treating patients who have COVID-19.
Erwin, what's the benefit? It seems like a layup to people like me who are not doctors like you two are, to not recommend that people take things that we don't have evidence actually work or could do some harm. And yet the president seems committed to putting these things out there. I'm not asking you to get into President Trump's head, but what's the impulse behind pushing either cures that don't work, therapeutics that don't work, talking about a vaccine sooner than the scientific community believes one will be available, discussing opening up and getting out there? What do you think the driving force is here? Because most thinking people believe that public health rules should be the driving force.
Of course, and I think any rational person wants to know what the scientists, what the evidence is showing us before we leap into these uncharted waters of, for example, taking the hydroxychloroquine, as the secretary just said. Listen, we're in a situation now where the president has himself become, and I've said this before, a public health hazard. Personally, he's out there touting, promoting grossly inaccurate information, and information that is, by the way, is dangerous. The thing, too, is, Ali, if you took hydroxychloroquine or if I took it, maybe we'd influence 2 or 3 people. The president influences millions and millions of people when he says something that's ignorant or untrue. And that's the situation we've gotten ourselves into. Why he's doing this? Who knows? It's probably convoluted into some particular political agenda that he thinks will or won't help him in the election in November, but who knows?
Gentlemen, good to see you this morning. Dr. Erwin Redlener is the director of the National Center for Disaster Preparedness at Columbia University, and Dr. David Shulkin is the former Veterans Affairs Secretary with the Trump administration.